Hello everyone, how are you all? Hope you all are doing great. My name is Alicia and welcome to my channel. Today I'm going to talk about adaptation program for nurses in Ireland. So make sure you watch this video till end because in the end I'm going to tell you how you can clear your adaptation program in 6 weeks without any hassle, without getting any extension or without getting failed. But before I start, I would like to request you, if you're new to my channel, make sure you subscribe to my channel and hit the like button. It will take just 1 minute for you, but for me, it will give me encouragement to make more contents like this. What is an adaptation program? In order to work as a nurse in Ireland, you need to get license. And for this license, you need to give license exam. And there are two type of license exam in Ireland. One is RCSI Aptitude test and another one is adaptation program. So today we are going to talk about adaptation program. It is basically designed for you to get yourself adapted in Irish healthcare system. During this 6 weeks of period, you have to complete theory and clinical competency which falls under 6 domains. Number 1 is professional values and conduct of the nurse. Number 2, nursing practice and clinical decision making. Number 3, knowledge and cognitive competency. 4th, communication and interpersonal competencies. 5th one, management and team competencies. And last one, leadership and professional scholarship competency. An adaptation program is not only limited to these 6 domains. Apart from these 6 domains, hospital will also cover classes like needle stick injury, infection control, sepsis, blood transfusion and blood products, and various codes, BLS, ACLS. So adaptation program is not only limited to these 6 domains. So there are n number of things as per hospital protocol and policy. So how this adaptation program really works? So when you'll join your hospital, you'll have induction class for 2 or 3 days, and then they will assign your wards to you, and in ward they will assign you with a registered nurse, and that nurse will be your preceptor for 6 weeks. So as I said before, that this program is of 6 weeks. So first week will be your induction classes and kind of introduction, and you will be on an observation period. You'll not be doing anything. You'll be just observing your preceptor, and you'll be taking rounds with her. So week 2. In week 2, they will give you a patient. So they can give you 1 or 2 patients. Usually they start with 1 patient. Like you'll get 1 patient and you have to do everything for that patient. So you can do medications, you can do vitals, and everything like whatever we used to do as a nurse. So you have to do everything, but you have to do under the supervision of your preceptor. That's the registered nurse. So basically in some hospital you're not allowed to give injections because you need to have a license to give injections. But apart from that, you are allowed to do everything like dressings, doctor's round, pharmacist round. You can do everything. But you have to do everything under your preceptor's supervision. So in week 3, you'll get 2 to 3 patients. Usually you'll get in the beginning of week 3 you'll get 2 patients, and by the end of 3rd week you'll get 3 patients. So usually you'll get 2 to 3 patients, depend upon the condition of the patients as well. So if they are sick, they will give you 2 patients. If they are like okay, they will give you 3 patients. So you have to work as a nurse but under the supervision of preceptor. So just like 3rd week, in 4th week you will get 4 patients, in 5th week you will get 5 patients, and in 6th week you will get 5 or 6 patients depending upon the patient condition. And by that time you should be able to work as a nurse. You should be able to do everything. As I told before, apart from injection, you should be able to do everything. You should be able to assess patient condition. You should be able to act in case of any emergency, and you should be well aware of what you are doing. But you have to do everything under the supervision of a preceptor. So if you think you are confused, you can always take help from your preceptor. And if you think that you're doing something wrong, so you can ask their help as well. So when you will start your adaptation, hospital will give you two booklets. One belongs to NMBI, in which your final assessment will go to NMBI, and another set of booklet, I think it stays with the hospital or with your main preceptor, because that booklet consists of 6 sections, and each section is particular for each week. So at the end of first week, you need to write, there will be 2 columns, so you need to write kind of self-assessment or outcome for yourself. So you'll be writing what all things you have learned and how you did, like if you dealt with some emergency situation, for an example. So you can mention that emergency situation, that was the emergency situation. Just for an example, patient went into sepsis, and how you did it, how you called the doctor, how you cope up with that. So you can write anything, like if you think that you learned something new, some new dressing or some new thing, so you can write that. And after that, you will give that section, you will give that particular thing to your preceptor, and she is going to comment on that. So she will comment whether you did well or you need more improvement, or in which area you're lacking basically. So if you're getting bad comments in your first week, don't get upset. Just try to improve, because in beginning everybody gets bad comments, but later on everybody improves. And I think that they intentionally give bad comments in beginning, just so that we can work hard and we can improve ourselves. So just like that, at the end of every week, you will write comment for yourself, and then your preceptor will comment on that. So like that, you have to fill that booklet. So that booklet consists of 6 weeks, and you have to fill it accordingly. So let's talk about another booklet which belongs to NMBI. So your preceptor and you are not going to write anything on that booklet. Your main preceptor, who is the nursing educator of that hospital, is going to comment on that booklet. And how she is going to comment on that booklet is she will come in between, and she will talk to you, she will observe you, she will check your files, and she will talk to you, she will take your feedback. And after that, she will talk to your preceptor, she will take your preceptor feedback about you. And then during this adaptation program, there will be meetings. So there will be 2 meetings. So in first meeting, they will call your preceptor, they will call your clinical nurse manager, and you'll be there. So there will be a meeting, and they will discuss in which areas you are lacking. So if you're lacking somewhere, it will go into your NMBI booklet, but don't worry about that, because it's just your first meeting, and definitely you still have chance to improve. So usually it's just like a general meeting. So in that meeting, they will tell you where all you are lacking, like if you're lacking some leadership qualities, or if you're lacking some particular nursing skills, if you are too slow or too quick, or whatever it is, they will tell you and they will correct you. At the end of 6th week, or when you are about to end your adaptation program, just before that, there will be final meeting, and that final meeting will be held between you, your preceptor, your clinical nurse manager, and your nursing educator. So they will discuss about you, and they will discuss everything, and then they will come to this decision whether you need extension or whether you are successful in this adaptation program. So now it's time for me to tell you how you can clear your adaptation program in 6 weeks without any hassle or without getting any extension. So as I said before, your first week will be for your induction and observation period. So I would recommend use this observation period as much as you can, because this is the only time you can learn most important things like timings for doctor's round, timing for discharge, and routine of ward. So you'll be assigned in your particular area, so you have to orient yourself to the ward, like which room number is where, and doctor's name, who is the surgeon, who is consultant, who is registrar, and how to ring doctor in case of emergency. So just keep one pocket diary with you and try to note down everything. Another most important thing which will help you to clear your adaptation in 6 weeks, and you will clear without any hassle, is to gain your preceptor's confidence. So you have to show your preceptor, because you have already worked as a nurse in your own country, and you know each and everything. So you have to show your preceptor that you are sufficient enough to do a dressing, or you know how to do it, and you know the basic. You just need to know the protocol of that particular hospital, but you know the sterile techniques, you know each and everything. So you have to gain your preceptor's confidence. And another thing is, you have to develop leadership quality. By leadership quality, I mean, don't try to react over smart. Like, just try to react intelligent, and just try to be very alert and active, and try to take up the responsibility. So whenever there is an emergency, don't try to hide, and don't just try to run away from the situation. Try to face it. If you don't know how to face it, take help of your preceptor. Because this adaptation program is not only about assessment of your clinical competency, it's also about adapting yourself into the Irish healthcare system. So it's not only about you, it's about hospital as well. They also have to teach you their policy, their protocols, and how they are doing things. Like, you may know how to discharge a patient, but you have to learn the way they are discharging the patient, because when they are discharging the patient, they are giving lots of leaflet, they are arranging lots of things for the patient. So you need to learn all these things. So for sure it will take time, and for sure you will make some mistakes, you will miss something, but just don't just try not to do any blunder, not to do any big mistake. If you're missing something, or if you are getting confused somewhere, always take help of your preceptor. And after learning everything, by the end of 6 weeks, I am sure you'll be an expert. So just trust yourself, and whatever they are teaching you, just make sure you keep your heart and mind open to all new learning. So when you'll complete your adaptation program after 6 weeks, your nursing educator will sign off your NMBI booklet, and that booklet will go to NMBI. And after that, you can apply for your PIN, and then you just have to wait for your PIN. And once you get your PIN, you'll be ready to work as a staff nurse in Ireland. Hope this video will be helpful for you. If you have any doubts regarding adaptation program for nurses in Ireland, you can comment me in the comment section of this video, and I'll try my best to help you out. Thank you for watching. Until next time, bye bye. Take care of yourself and your family.